Today we are diving into one of the most talked about, most misunderstood, and let's face it, most uncomfortable symptoms of the menopausal transition, and that is hot flushes and night sweats. So grab your cup of tea, or if you are already sweating, maybe a cool drink, and let's get started. Welcome to Menopause Nurse Memos, empowering midlife one memo at a time, the podcast where we tackle perimenopause and menopause topics head on, with honesty, empathy, and a whole lot of heart. I'm Vicky Ellison, a nurse for 33 years and an advanced menopause specialist nurse practitioner, an independent prescriber, and founder of Calm Menopause and Wellbeing Clinic based in Appley Bridge. Vasomotor symptoms is the fancy term for hot flushes and night sweats. So what are they and what causes them? Well, hot flushes or hot sweats are a sudden feeling of intense warmth, usually in the face, neck and chest. Your skin may turn red, your heart might race, and you will probably start sweating. When these symptoms happen at night and you wake up drenched, sometimes needing to change the sheets, these are called night sweats. These symptoms can last from 30 seconds to 10 minutes, and for some people they happen once a day. For others it can be multiple times an hour. It isn't fun. So what is the reason behind this? Well, the primary driver behind hot flushes and night sweats is the hormone estrogen. During perimenopause, which are the years leading up to menopause, your estrogen levels start to fluctuate. This isn't a smooth decline, it's more like a roller coaster ride. One part of the day it is high, and then it's low. Estrogen plays a key role in regulating the hypothalamus, which is the part of the brain responsible for controlling body temperature. When estrogen levels drop, the hypothalamus gets a little confused. It starts to think that you are overheating, even when you are not, and causing your body to react with a hot flush or sweating during the night. So what does the hypothalamus do? Well, it triggers your body's cooling system, which causes your blood vessels to dilate, causing that flushing feeling. Your sweat glands activate and your heart rate increases. This is your body trying to cool itself down, and this occurs even if it doesn't actually need to. That's what causes hot flushes. The same happens at night, but there is added sleep disruption, and it becomes a whole new level of distress because broken sleep has such an impact on daytime symptoms. There are other triggers and contributors that can cause hot flushes and night sweats. But here is the thing, hormones aren't the whole story. Stress and anxiety can cause hot flushes. They stimulate the same part of the nervous system. Caffeine and alcohol, both can dilate blood vessels, so keep these to a minimum. Spicy foods, hot drinks, or a warm room are other contributing factors. And smoking is a big one. Nicotine disrupts the balance of hormones and affects the hypothalamus, making it more sensitive to temperature changes, which causes hot flushes. Finally, certain medications, such as some antidepressants or steroids, can have side effects of hot flushes, so be mindful if you are taking these. Oh, and let's not forget individual variations as well. Some people are genetically more prone to hot flushes and night sweats. So when do these hot flushes and night sweats start, and how long do they last, is often the most important question. Will they ever stop is a question many women ask. Hot flushes often begin in perimenopause, sometimes as early as your late 30s or early 40s, and can continue well into postmenopause. On average, women experience from several years, but 1 in 3 may have them for a decade or more. The intensity usually peaks around the time of your last period and gradually diminishes, but this is not always the case. Some women will have them for a very long time. So when should you seek help and what help is available? If hot flushes and night sweats are affecting your sleep, mood, or quality of life, please know you are not supposed to just suffer through it. There are options, such as hormone replacement therapy. This is the most effective treatment. It works by replacing the estrogen your body is losing. For most women, the benefits of taking HRT outweigh the risks from not taking it, especially if started before the age of 60 or within 10 years of the menopause, that being the last period. However, for some women not able to take hormone replacement therapy, or those who don't want to, there are non-hormonal medications that may help, such as selective serotonin reuptake inhibitors and serotonin norepinephrine uptake inhibitors, which are also known as antidepressants. Clonidine is a blood pressure lowering medication, and gabapentin, usually used as an anti-seizure or neuropathic pain relief medication, can also help reduce hot flushes. These block the neurotransmitter GABA by slowing down the part of the brain that controls the body's temperature. However, these drugs are usually unlicensed for the treatment of hot flushes, so may require a specialist to initiate them. Lifestyle adjustments like dressing in multiple thin layers, using a cooling pillow at night to help sleep, reducing caffeine and alcohol, as well as practicing relaxation techniques such as breathing exercises and yoga can all make a difference. Cognitive behavioural therapy has also shown promising signs for reducing the impact of hot flushes, especially at night. Cognitive behavioural therapy helps individuals to identify and challenge negative thought patterns and behaviours by teaching relaxation techniques like paced breathing to help manage physical symptoms. And new treatments are being developed. Most recently, fezolinetant has been approved by the MHRA. This is a non-hormonal drug targeting the brain's temperature control centre. It is offering new hope for those who can't or don't want to take hormones. However, these are currently only available through private menopause clinics, and regular liver enzyme blood tests will need to be monitored. So there you have it. Hot flushes and night sweats are more than just inconvenient symptoms. They are signals from your body that your hormone landscape is changing. You don't have to suffer in silence. Talk to your GP, nurse or menopause specialist. Ask questions. Explore options and treatments. There is no one size fits all, but there is something that can help manage night sweats and hot flushes for everyone. Next time on the podcast, we are talking mood swings and mental health. Thank you for spending time with me today on Menopause Nurse Memos. If this episode resonates with you or you know someone who needs to hear it, then share and leave your comments in the chat. And don't forget to subscribe so you never miss an episode. Until the next time, take care of yourselves. You are worth it.